So how FOGSI has strategized the adoption of improving the access to healthcare in the rural areas?
FOGSI is working on several initiatives for that, but first of all, FOGSI is the Federation of Obstetrics and Gynaecological Societies of India. We have around 44,000 members spread over across 272 societies. We have seriously been concerned and looking at the heterogeneity in the resource settings that exist within our healthcare system. We have places where there are very, very basic facilities, and then we have places where there are all these very large big box so-called hospitals. The concern has always been how to make sure that there is some kind of a standardization between both of them. And we have two major initiatives for this. There's one called the Manyata initiative, which essentially looks at small private sector facilities. It also looks at large private sector facilities, but also small private sector facilities. And there has now recently been a tie-up with NABH, where we hope that there will be an increased uptake of standardization of these small healthcare facilities. We also have another initiative which is funded by the Bill and Melinda Gates Foundation, where we are going to work in 29 districts across 4 states. And within these 29 districts across 4 states, particularly in small private care healthcare facilities, we are going to try and improve the quality of care which is given in the intrapartum period. As you know, the large amount of mortality in mothers occurs because of intrapartum events. So we are going to try and improve the quality there and also introduce and scale up the uptake of innovations. For example, introduce and uptake the innovation like IV iron or IV FCM as it is called, because there is a direct link between a woman who goes anemic into labor and the perinatal and maternal outcome. So these are a few of the things that we
Okay, any plans in the Northeast?
well, in the Northeast, we are already working with several other organizations. I believe that we are planning to roll out some work, hopefully in the tea plantations, particularly where the mortality rates are much higher than they should be. I cannot exactly give you the details now, it's a work in progress, but I must say that FOGSI has been working in the Northeast areas for a very, very long time through its societies. All the states in the Northeast have their own societies, and all the presidents and secretaries of the societies are very active not only in providing services but also in making sure that the latest information is disseminated to all the members of the Northeast.
Thank you so much.
So, থিমটো হৈছে মাতৃ স্বাস্থ্য লোক স্বাস্থ্য মানে মাতৃ স্বাস্থ্যই আমাৰ সমাজৰ স্বাস্থ্য যিটো কয় আৰু আমাৰ এই উত্তৰ পূৰ্বাঞ্চলৰ যিখিনি যিমান সমিতি আছে সদায় স্ত্ৰী আৰু প্ৰসূতি ৰোগ তথা আমাৰ বিভিন্ন সময়ত বিভিন্ন আমি স্বাস্থ্য শিবিৰ পাতোঁ আমাৰ কেঞ্চাৰ ডিটেকশ্যন প্ৰগ্ৰেম আছে তাৰপিছত আমাৰ কিছুমান সৰু সৰু সভা হয় ৰিচাৰ্চ কিছুমান পাব্লিকেশ্যনছ হয় সেইখিনি কৰি থাকোঁ আৰু এটা আমাৰ এইটো এটা অৰ্গেনাইজেশ্যন আছে নৰ্থ ইষ্ট এছ'চিয়েশ্যন অফ অবষ্টেট্ৰিক এণ্ড গাইনেক'লজি ছ'চাইটি উত্তৰ পূৰ্বাঞ্চলৰ সামূহিক অনুষ্ঠান এইটোৱে বিভিন্ন ঠাইত উত্তৰ পূৰ্বাঞ্চলৰ বিভিন্ন ঠাইত বিভিন্ন স্ত্ৰী ৰোগ প্ৰসূতি ৰোগ শিশু ৰোগৰ সম্বন্ধে আলোচনা চক্ৰ অনুষ্ঠিত কৰে
এইটো কনফাৰেন্সৰ জৰিয়তে কেনেদৰে সব হস্পিটেলছবোৰক হেল্প হ'ব
আমাৰ ইয়াতে আজি ধৰক প্ৰায় 400 বিভিন্ন ঠাইৰ পৰা আহিছে 400 ডেলিগেট আছে তেওঁলোকে ইয়াৰ পৰা যিখিনি শিক্ষা গ্ৰহণ কৰিব তেওঁলোকৰ আপলিফমেণ্ট হ'ব আৰু এটা সামূহিক চিকিৎসা প্ৰতি আমাৰ সদায় CMA কণ্টিনিউ মেডিকেশ্যন আমাৰ অবিৰত চিকিৎসা সেৱা বুলি কয় অবিৰত চিকিৎসাৰ এটা পাৰ্ট আৰু আমি এইবাৰ আসাম মেডিকেল কাউন্সিলৰ পৰা ক্ৰেডিট আৱাৰ্ছো লৈছোঁ সেইটো কাৰণে